Coronavirus is an infectious disease caused by a newly discovered coronavirus. It has been one of the greatest catastrophes of the modern world. The general perception is that everyone is equally susceptible to coronavirus, but it's not the entire truth. Some communities are more susceptible to this highly infectious disease than others. The Muslim community is currently the top target of the virus. There are a number of reasons why the COVID-19 outbreak is killing more Muslims than others. Hi and welcome. This is TFI Global, the foreign affairs and geopolitical analysis arm of the TFI Media Group, and I'm your host, Atul Mishra. In this video, I will tell you about why more Muslims in the world are dying due to coronavirus and the factors contributing to this strange anomaly. Let's begin. The COVID-19 pandemic is a global catastrophe, but the effects of the pandemic aren't shared equally. Social taboos, lack of education, and poor adherence to COVID-appropriate behavior are leading to disproportionate rates of infection and deaths in the Islamic community. This isn't peculiar to any one part of the world, and different parts of the world are experiencing that the Muslim community is more severely affected by the coronavirus outbreak. Reports from France, the United Kingdom, and Israel hint that deaths amongst Muslim communities due to the COVID-19 pandemic in these countries has been much higher than the general COVID-19 death rate. So why has the pandemic hit the Muslim community harder? There are several reasons to blame for this aberration, but the most prominent among them are issues stemming out of a common lack of awareness. Lack of education and consequent awareness in the Muslim community have created a tendency of not adhering to COVID-19 guidelines. Similarly, another reason for large number of infections and deaths in the Islamic community is a tendency to live in overcrowded ghettos, which is visible in many parts of Europe, Asia, and other parts of the world. It has resulted in much faster spread of the virus within the community. Also, lack of education has led to greater engagement in menial, low-paying jobs that leads to more exposure to the virus in the community. And then lifestyle habits are other factors leading to higher coronavirus deaths in the Islamic community across the world. It is scientifically established that inbreeding leads to a weak gene pool and low immunity. The massive inbreeding in Muslim culture may well have done virtually irreversible damage to the Muslim gene pool, including extensive damage to its intelligence, sanity, and health. According to Senels, close to half of all the Muslims in the world are inbred. In Pakistan, the numbers approach 70%. Similarly, dietary habits that involve excessive consumption of meat again lead to deficiency problems that bring down the immunity levels, which puts a large section of the population at risk of being affected by the pandemic. Finally, there's a social issue of domination by clerics. When the clergy decides norms of behavior, scientific principles take a backseat. Orthodox elements started vilifying the use of non-halal products like alcohol-based sanitizers and even vaccines that again exposed almost the entire community to the deadly virus. In France, gathering data based on religion and ethnicity is forbidden, but Reuters has reportedly collated data that shows how Muslims have been hit harder by the COVID-19 outbreak in France, which is estimated to have the European Union's highest Muslim population. Data collected by Reuters also suggests that the COVID-19 death rate in French Muslims is much higher than in the overall population. As per Reuters, excess deaths among French residents born in majority Muslim North Africa were 2.6 times higher in 2020 as compared to the French-born residents. Also, French residents born in sub-Saharan Africa recorded 4.5 times higher deaths than the French-born residents. It is reasoned by community leaders and researchers that French Muslims tend to have a below-average socio-economic status. They are more likely to be employed in low-paying jobs, reside in cramped households with multiple generations, and earn lower hourly wages than the national average. This is contributing to a higher impact of the COVID-19 crisis on French Muslims. The United Kingdom, another European country with a high proportion of Muslim population, too has recorded disproportionately high number of COVID-19 deaths amongst its Muslim residents. As per data from the United Kingdom's Office of National Statistics (ONS), 4,191 Muslims died due to the coronavirus by the end of February this year. The data on COVID-19 deaths in England shows that the Muslims are by far the worst affected community in the country. The death rate amongst UK-based Muslims is twice as high as that amongst Christians residing in the country. The ONS report is silent on the reason behind disparity in the number of COVID-19 deaths between different religious groups, but experts again point out issues like low income and menial jobs, which increases exposure to the virus. Outside Europe too, the COVID-19 pandemic seems to be affecting the Muslim community disproportionately. In Israel, a health ministry study published on Thursday revealed that the death rate from the coronavirus amongst Israeli Arabs has been 3 times higher than that recorded in overall Israeli population. In India too, there are indications of unequal impact of coronavirus due to insecurities, vaccine hesitancy, and rumors. Take the case of the Aligarh Muslim University, a university whose status as a minority institution is presently sub judice. Recently, 38 university teachers, including 17 serving ones, died of COVID or COVID-like symptoms. Even in other parts of Asia, there were religious dictums regarding vaccination. Last year, Indonesia, the most populous Muslim country in the world, had announced that any COVID-19 vaccine would have to be halal certified by the country's Islamic clerical body. Ultimately, China's CoronaVac was declared Indonesia's Ulema Council as holy and halal. Halal is the Arabic word for permissible. Halal food or products, and in this case vaccines, are those which adhere to Islamic law. Non-halal products, referred to as haram, are generally viewed as a taboo among Muslims. But like all other countries that used Chinese vaccines, Indonesia too found out that the Chinese vaccines are ineffective. Presently, Indonesia is undergoing a health crisis despite using Chinese vaccines. As for hand sanitizers, many in the Muslim community feel that since they contain alcohol, they are haram according to Islamic law. The fact remains that the COVID-19 pandemic has affected the entire world, but differences in socio-economic status, dietary habits, tendency to live in ghettos, weak immunity due to practices like inbreeding, and overall lack of general awareness regarding health facilities have reportedly affected the Muslim community most severely in several parts of the world.